All right, we're going to cover a number of lectures, and what we're going to do is we're going to cover the clavicle, the scapula, the humerus, and the others. So let's begin with the clavicle. So the clavicle is this one, sits like this here, and we have the clavicle right here. On top there is nothing on, underneath is what we have features on. Here is the conoid tubercle, then this is the trapezoid line. This too we have the coracoclavicular ligament attaching to it. This is the groove, the subclavian muscle. This is the impression for the costoclavicular ligament. This is the acromion side. This is the sternal side. We put that one down and come to the scapula. Here is the scapula. The borders of the scapula. When you look at the borders of the scapula, you have the lateral border, the medial border, the superior border. This is inferior angle. That's a superior angle. This is the spine of the scapula. So I will use this scapula here to indicate the things I'm going to go through. So here's the spine of the scapula. The spine of the scapula continues to become the acromion process. Right here is a crest of the scapula. Then you come to the surfaces. The spine of the scapula is going to give us supraspinatus fossa and infraspinatus fossa. On top of here, the border is a suprascapular notch. If it's closed up, is suprascapular foramen. Then this, in the anterior side, is subscapularis fossa. This is a glenoid fossa. The glenoid fossa has on top of it supraglenoid tubercle, and underneath is infraglenoid tubercle. Right on top of the glenoid fossa is a coracoid process, which is an extension that goes here. Between them is the spinal glenoid notch, this spinal glenoid notch. Then you come to the attachments, which we'll deal with later on. I will put this one down. We'll come to the humerus. Here's a humerus bone. Now the humerus bone is actually the longest in the upper limb, and here is the medial side, which is attaching itself to the glenoid fossa, giving us a glenohumeral joint. We'll begin with the head. This is the head, followed by the anatomical neck. Surgical neck is here. This is where a lot of fractures will happen. This is the lesser tubercle, continues with the crest of the lesser tubercle. This is the greater tubercle, which is lateral, continues with the crest of the greater tubercle. Between them is the intertubercular groove, or intertubercular sulcus, attachment for some muscles. You come to lower side, and just you come to the lateral, this is the deltoid tuberosity. Next to the deltoid tuberosity, the spiral line that runs like this. This is spiral groove. In the spiral groove, you have the deep artery of the arm and the radial nerve running in. If you come lower, this is supracondylar ridge. Supracondylar ridge takes us to the medial epicondyle. This is the lateral supracondylar ridge, takes us to the lateral epicondyle. Medial is a trochlea. Lateral is the capitulum. Now there are fossas here. This is a coronoid fossa. This is a radial fossa, and you can see those come in a matter of flexion. We come to the posterior side. In the posterior side, you have the olecranian fossa. Olecranian fossa receives the olecranian process from the ulna. I will come to the surfaces. This is the anterior medial surface. This is the lateral, anterior lateral surface, and behind is a posterior surface. Now I'm going to stay a little bit in here to show you the coronoid notch and coronoid, the trochlea, which is going to receive the trochlea on this side. Now let's go to the lower side. Here we have the ulnar. This is the radial. I'm going to use separate bones to be able to define those ones. So I'm going to pick the radial first. When I talk about the radial, here is the radial, and you can see the radial has the styloid process. So here is the head of the radial. This is the neck of the radial. Right about here is the notch of the ulnar. This is the radial tuberosity. Then you come to the borders. This is the interosseous border. This is the anterior border. and the posterior border is behind it. The surfaces, this is the anterior surface. If you turn like this, you come to the posterior surface. This is the lateral surface. This is the started process of the radius. And then you have the articulating surface for the scaphoid, articulating surface for the lunate. And of course, here is where the radius is going to articulate with the ulnar. We'll put this one down, and you can see when I talk about articulating, you can see where the scaphoid is articulating with the radius, and the lunate is articulating with the radius. So those are articulating surfaces. Now we come to the ulnar. The ulnar is medial, so I'm going to pick up the ulnar bone, and you can see the ulnar. This one is an ulnar bone. It's medial. We'll look at the ulnar. This is olecronian process. This is coronoid process. This is trochlear. This is the notch for the radius. The radius is going to articulate here. This is supinata crest. This is supinata fossa. This is tuberosity of the ulnar. The borders. This is the interosseous border. This is the anterior border. That's the posterior border. Again, we'll have the anterior surface, you have the posterior surface, and the lateral surface. The ulnar has also an extension here. The ulnar has an extension here. You can see it right here, and that gives us the started process of the ulnar. The radial is going to participate in the wrist joint. The ulnar does not. Now, we will look at the bones of the hand. So we're going to go ahead and look at the bones directly of the hand, and I will use, maybe this will be a better way to explain them. Let's look at the proximal line, and then we'll look at the distal line. On the proximal line, beginning from the lateral side going to the medial side, this is the scaphoid. You can see the scaphoid, the biggest bone here. This is the lunate. This is the trochlear, and this is the pisiform. The distal part, this is the trapezium. This is the trapezoid. This is the capitate, and this is the hamate, and you can see the hook of the hamate. We come to the hand. So this is the carpus. This is the metacarpus. The metacarpus are 1, 2, 3, 4, 5, and this is the metacarpus. And then this is the phalanges. The phalanges are 3 on the 4 lateral fingers. The thumb has only 2. This is the proximal, the distal. The proximal, the middle, and the distal. And this one only has the proximal and the distal. And that's the bones of the upper limb. Thank you.